Hello, good evening, and how you day? How far? Happy Sunday to you. The time is 8 p.m. here in Nigeria. This is the health. This is Ask the Doctors, a program that holds every Sunday by 8 p.m. My name is Dr. Frederick Onubohai. I'm a licensed medical doctor, and I'm the host of this program. My co-host is Dr. Robonoso Saza Israel. How are you? Where are you watching me from? I hope you can hear me, right? Good. If you can hear me, tell me where you're watching me from. Today's program would be about the kidneys. We are talking about secrets to healthy kidneys. Can you hear me? Tell me where. Yes, we are talking about secrets to healthy kidneys. Um, on the program tonight, we'll give you some of those tips that can help your kidneys, the things to help you avoid, the things you need to do, the things you need to stop doing. But before we start, and before I bring up my co-host, tell me, where are you watching me from? We are live on Facebook, we are live on YouTube. And let's see. Hi, good evening. How are you? Good evening, Prince from Kogi. Let me see. Should I add let me add X, right? Okay, let me add Twitter. Let's see if we can be live as well on Twitter, right? Okay, good. Prince is watching me from Kogi State. Joanne is watching from Lagos, Aja. Hi, Joanne. Hi, is Aja. We have Onyeka watching from Anambra State. If you are just joining in, tonight we're talking about secrets to healthy kidneys. What are those things you can do to help your kidneys? What are those things you need to stop doing to help your kidneys? And then we'll take your questions. I want to again, let me see. Yeah, I'm watching from where? I'm watching from Ikot. Ikot where Nko Idideb. Okay, I hope I got that right. Now, quickly, last week Thursday was the World Kidney Day, and for those who are aware, we have a lot of people, we have a lot of Africans, a lot of Nigerians with kidney problem, kidney disease, and it's important we talk about those things that can actually help your kidneys. Are we together, right? Do me a favor, share this live session. Share the live session so that more people can join us and can listen to us. We are live on Facebook, YouTube, and X. Should I go live on TikTok? Let's leave TikTok for now. Okay. Now the first thing I want you to understand that your kidneys are like filters. But if you have seen somebody with kidney failure, if you have seen somebody with kidney disease, you, oh my God, I they speak English. Must switch over. If you don't see somebody will get kidney problem before, if you don't see somebody will get kidney failure before, you go do everything within your power to avoid kidney disease. You hear me so? Because kidney failure, kidney disease, especially the people who need dialysis, who will need transplants, most times it dey wreck family financially, and this is not something we should experience. So we decided that let's talk about those things that can help our kidneys. My co-host is around tonight. His name is Dr. Irobonoso Saze, also a medical doctor, a licensed medical doctor. Dr. Israel, if you are ready, just give me thumbs up and I'll bring you up. Okay. Yeah, Dr. Israel, how far? How you day? Happy Sunday.
I'm fine. Happy Sunday. Happy Sunday to everybody.
Yeah, welcome. Watching from Lagos, Okoko Maiko. Hey, Ifunanya. So, Dr. Israel, ma hand over to you. I don't give small brief intro. So, I just hand over to you, and then we start talking about the secrets to help our kidneys. Over to you.
Okay. When we talk about kidney, I know say Dr. Fred, as last week we celebrate World Kidney Day. So we decided to use today to also put our voice, join everybody's voice as they talk about kidney and how to save our kidney. Kidney na one organ when most people they think say they quick they affected, or when even when they affected, most people not they look that place until wahala don't set. And kidney na say one organ when we just tell you say you get something with your kidney, you don't dey fear already, because most people know say once wahala don't dey for kidney, na not the day easy. Not the day easy. So what be this kidney? When we dey talk kidney, we dey talk kidney. I hope say we know where the kidney dey. The kidney na those two organs when we be like beans shape, where they our abdomen, they our abdomen side, they the somehow the back of our abdomen. I use that word like that. Now there it is. And this kidney, the good thing when God take bless us is that God gave us two kidney. But the funny thing is that human being can actually live a perfect life with just one kidney, but God bless us with two, because the kind of person where some of us feel be. So now make can bless us with two. So make we try, make we never make the two can get wahala. So kidney are those two organs be like beans shape, they the back, and then they help us, and they help us for the filter our urine when they make us see urine. Peace when they make us they see peace when we dey peace, when we dey peace. So from there we can now, this one I just a introduction just to introduce kidney to us, to tell us what kidney be and what kidney does for us. And so what be the function of the kidney, and what the kidney they do for our body. One, it dey help us they remove waste. They help us they remove waste. Waste in the form of urine. Those urine, that piece when you dey piss now waste product. So that na the way, one way when the kidney they help us to detoxify our body, because they help us they remove waste. And that na one thing. And which kind of waste? All those toxin when they our body, maybe when drug they cause, when some infection bacteria they cause, and some other things, or even when the body itself they cause, and some of all those toxin, some medications where we they take. Now make some people, if you take Ampiclos, you can't notice say you the pit, the Ampiclos they smell for inside your piss, because the urine, all those ones when they come out, now the waste when they the body. Now they get some chemicals for the blood. When the blood go work, will remove, go purify. When the blood don't they purified or contain waste, all of them go enter inside the kidney, and the kidney now go come make and come out as urine. So they help us they remove waste. Two, they help us they regulate water when they inside our body. They help us they regulate water when they inside our body. Now make, if you not drink water well, you go come notice say the piece where you the piece go dey yellow well. Because the water when they inside the body must make sure say the normal water when the body need, the body get am. Whether you like it or not, the body must get a normal water. So the kidney go help us regulate that water, so that if water when you drink many well, the kidney go remove a lot of water from the body. However, if the water when you drink dey very small, the kidney go keep some of those water, you keep many of the water and remove very small water from the body. That make most people when they drink a lot of water, you'll notice say you they go urinate well. And when that one happen, I go tell you say yes, it shows say your kidney they work. Yes, that's what it shows, because they help you they regulate the water. Another thing where they help us they do, they help us they check our blood pressure. And they help us they check our blood pressure. I tell they do that one, they help us they remove too much salt from the system. So the sodium chloride channel and all those things, they help us they checkmate sodium, potassium, they help us they checkmate all of them, so that make salt not too much for our body. So in that way, they help us they check our blood pressure. Another thing when they do, they help us they produce one hormone, and when they responsible for production of red blood cell. Get one hormone when the body, when the kidney they help produce, and that hormone, what they call erythropoietin, then they help in the production, they join the help in the production of red blood cell, of blood for the body. So now make most people, when they don't get problem with their kidney, they can't see say their body they white, they no can't get blood, so they can't look for, they can't say, hey, we need blood, we need blood, we need blood, and so on and so forth. There are so many other things where the kidney they help us do, but I think these ones when I mentioned, these ones when I mentioned, they are just like and the most important, the ones where we the quick see when we think we talk about. Another one I will say they help us for our bone health, the bone, our bone, the kidney still they help us. And I tell they help us, you get one vitamin when the kidney they help they activate vitamin D. Now the kidney they produce some hormones, some chemicals where they help to activate vitamin D. So when they activate that vitamin D, the vitamin D will come work for our bone, come make our bone they healthy. You can see say the kidney get a lot of function, and a lot of function. I think I'll stop here so that I make Dr. Fred talk one or two things. Dr. Fred.
Yeah, thank you so much, Dr. Israel. We talk about secrets to health kidneys. And the thing they say, it go good, may you know the normal function of your kidney so that it will give you an idea. May you see the kind of work where your kidneys they do. Dr. Israel talk about the blood pressure regulation. They help you regulate fluid for body. They help you regulate electrolytes. They help your vitamin D. They help blood formation and many, many things. But it gets things where we as human beings, they do. Some of them we know, some of them we don't know. And those things, they put our kidneys at risk. Now, please remember that this program is strictly for educational purposes only. If you get any sickness, you get any medical disorder, any medical complaint, we go always beg you, make you go hospital, sit with your doctor, make them check you. So let's start quickly. What are those things that okay, I see some of my people on YouTube. Yes, in case you don't know, we did live on YouTube, we did live on Facebook, we are also live on X, that is Twitter. So many people they watch us right now, and I can see you all. Hi, Juliet Richard, watching from Benue. Now, very commonly, waiting be those things where they affect the kidneys negatively. Waiting be those things. The very common one that is under our control, now our lifestyle. Very popular. You know it. I know it. We talk about it every day. Sometimes you go vex, sometimes you go happy. But these things can put the kidneys at risk. Now, the funny thing again, before I hand over to Dr. Israel, is that the two kidneys, one kidney feed they spoil, or the two kidneys feed they go bad. Small, you go get no idea, no knowledge, no sign, no symptom. And this is why people go say, but doctor, now waiting happen. I've been there fine since I've been there fine. I just go check and then tell me, say my kidneys are bad. So the kidneys can actually be going bad gradually without you having any sign at all. Are we okay? So the first thing about your kidneys are your lifestyle. For those who smoke, for those who take shisha, igbo, Refnol, Molly, whatever you take, those substances are harmful to the kidneys. They affect the blood vessels, your capillaries, where they the kidney. Small. You go they spoil. Would they spoil the kidney? But you know go know. But doctor, now in the olden days, our forefathers did all these things. You don't know about their body. You were not a doctor. They no go hospital. They no do tests. So you wouldn't even know. And in the olden days, your forefather fit by, nobody go find out what happened. They go talk saying now so God wants them. So these are things that can actually do waiting, spoil the kidney, your lifestyle. The ones under our control, smoking. Now, alcohol, they are among the things we also feel affect the kidneys negatively. Smoking, alcohol, and then your diets. people where they chop. You see, you get how you go chop processed food, you go chop food we pack salt inside. All this food where you they chop indirectly, this food go they push your blood pressure up gradually. As your blood pressure they go up, they go up, they go up. If you no control the blood pressure, later on, the blood pressure where you no control go they damage the kidneys small small. So uncontrolled high blood pressure we fit come up from the kind things where you also they chop. And then one other one where I go hand over to Dr. Israel. Now the use of bleaching creams. A lot of young people for this generation, they want fresh, they want fine, they want look like Oyibo, they want the skin to look like skin like milk. So they buy different chemicals. Organic cream, inorganic cream. Now, when they rub all these things on their body, those cream get harmful substances inside. And when you rub them on top your skin, they penetrates, they enter inside your body because your skin are organ as well. So when you rub all these things on your body over the years, even has evidence by research, they go enter your bloodstream. They go there, go they sit down on top the kidneys. You no go get any sign. You no go know. Say this thing they happen to your kidney small small, and then later on, the person kidney fit on they spoil, if you can't fail. This one a small one of the things we fit affect the kidneys. Share this video and then make I hand over to Dr. Israel. Dr. Israel, over to you, please. Yeah?
Okay, thank you. And Dr. Fred talked some of the factors or some of the things we feel affect the kidney. And most of the ones we talk, he actually dwell on our life, on our lifestyle. Yeah, that's where he dwell on. So apart from the lifestyle, that lifestyle are things we will feel control. Apart from the lifestyle we will feel control, there are still some other one where we go feel control. And then our medications and drugs. The medications where you they take, the drugs where you they take. Some of these medications can actually can actually affect the kidney. Apart from the one where we say, you just need to take that medication. However, in most cases, all this medication when you even need to take, there's always an alternative. Once you don't they get problem, once they know say it go affect your kidney, there's always an alternative. So some medications where would they take fit affect the kidney. And not be said because you take them today, you affect the kidney. No. Obviously they work. Some fit be say because you they take them continuously, like your NSAIDs, that is all those painkillers. What would they take? Some of these painkillers, what would they take? If we continue to take and continue to take and continue to take, and they fit affect our kidney. They fit affect our kidney. Some antibiotics fit affect our kidney. Then some drug where they never prescribe give us when some people they take cocaine and all that, heroin and all that, fit affect our kidney. So that's why it's very important. Say make we dey mindful of the medication when we they take, and not be just stay mindful of the medication. Take it as prescribed, and that's why we see they talk against self medication. Instead of you to go prescribe drug by yourself, they take and go hospital. Let your doctor prescribe the medication for you, so that once anything is up, the doctor will quick know and will quick change them for you, so that may nothing for happen to you. All those traditional concussion when people they miss and you miss different things, all those things fit affect the kidney. Yeah, so these are part of medication. Another one are condition, some medical condition when people get some sickness where they some people body. One, diabetes. People will get some chronic diseases like diabetes, hypertension, even HIV. Some of all these disease fit affect the kidney. Mostly when you don't manage them well. Mostly when you don't manage them well, they fit affect our kidney. Another one are genetics. Genetics. So this one now, not there our hand, not there our power, not be we cause them, but now some things we fit have put to people. So we won't talk about biological or genetic factors. And one of it now age. Mostly for people when it be say they get family, when they get kidney problem. So when your papa or your mama or your family, any member of your family first suffer for kidney problem, as you they grow old, it is good make you dey check your kidney well, because if it happen, yeah, if it happen. So there are so many other things, some other factors like autoimmune conditions and all that. And when we say those ones are not within your power, not be your hand, they just happen. Yeah. So when we say autoimmune, it means say the body they fight in yourself, and the body feel the kidney and all that. They see the kidney like foreigner and start to deal with them. So all those kind of conditions, it dey, and it's not be saying na you cause am, na as the body take handle am. Sometimes some na anatomical how I take put this one. So how the kidney take form, the kidney fit not form well, if you not get the correct forming of that kidney, so e fit still dey cause problem for the kidney itself, because they even dey make am not dey do e work very well. However, even for that one wey get anatomical malfunction or how e take form, e still dey your hand to make that kidney, even though how e be, to take work perfectly, if you not give am all that wahala, like your lifestyle, like the lifestyle wey Dr. Fred don talk about. Dr. Fred.
Yeah, thank you very much, Dr. Israel. We they talk about secrets to healthy kidneys. In case you did watch this program for the very first time, we have been having this live session every Sunday for the past 6 years. Every Sunday. So no be today we start. We they do and they come. The reason we they do them, not to raise awareness, not to teach you, not to beg you, to advise you, make you take your health seriously. You understand, right? Even people where they outside Africa, they watch us, they ask questions. We try our best to respond and attend and answer the questions. But I beg, yeah, no be hospital, yeah, no be clinic. You get any problem, you go enter hospital. We don't talk about some of the things wey fit affect somebody kidney. Are you even aware that even infection, recurrent urinary tract infection, wey dem no treat well, fit also affect the kidneys? This is the most important reason we dey make these videos, to beg you, say if you no be doctor, please no joke with your body. Whenever anything happen to you, always see a medical doctor, make dem check you. Are we together? So may we go to those little secrets, secrets to healthy kidneys. You know them, tips that can help your kidneys. We know them, you know them. Now, if you have any questions, drop your questions. We go answer you. I can see that we have 4 people watching us on X. I can see you on X right now. Hi. We are on Facebook. I see you. We are on YouTube. I can see the people also watching us on YouTube. So drop your comments and I'll try my best to read your comments. This person says there is so little awareness about our kidneys in Nigeria. I don't agree. I think there is so much awareness, but the problem is that the average Nigerian is looking for comedy, skits, funny jokes, waiting to make am laugh because of so much pain. The average Nigerian, no one listen to health education, health information. We dey talk about them, and I can tell you that on this program, we don't talk about kidneys so much. People should begin to go out of their comfort zone to research about their organs. I personally think once you are 35, there is need for one to go for vital organ tests from time to time. It's advisable that at least once in a year you get yourself checked. But for this country where we dey, so a lot of people know they take am seriously, and we are trying our best to raise awareness. Now, let's quickly talk about those things that can help our kidneys. The very important one, very easy, very common, is water. Adequate fluid intake. Can you imagine? Let me share with you a true life story. I was speaking with somebody and I asked the person, like, how many liters of water do you take? How many bottle water do you take? Or how many sachets of water do you take in a day? The person say, make I no lie, you. if I too drink water in a day, now one sachet of pure water, one, I mean one. The person can't tell me say, instead of make I drink water, I dey take coffee because I need coffee. My body need them to function. I can't shake my head. This person no understand that you are actually depriving your kidneys of adequate fluid, water inside your system. That coffee where you dey drink is saturated, is concentrated with many, many, many things inside. Water go help your body. So the first on the list where I go tell you here, first secret, first tip to help your kidney is water intake, fluid intake. You dey follow me? Now, if you dey follow me, I want you to put in the comment section and say, yes, I dey follow you. Before I hand over to Dr. Israel, let me give a shout out to this person here. Betty. Okay, yeah, Betty on YouTube. Betty just sent 1,000 naira super sticker. Betty, God bless you. You'll be one of our greatest supporters on this live session. Huh? Thank you so much. I see you. Dr. Israel, over to you. We'll talk about those secrets and those tips. And then we go start to the take questions. Huh? Over to you.
Okay. So, and yeah, Dr. Fred already give us the very first thing when we feel do for our kidney. And in fact, that's the best. That's that if you only do that one, you have done a lot for your kidney. Taking a lot of water. Because it will protect you for so many things, even kidney stone, it will help you protect against kidney stone and all that. So taking a lot of water will help you so much. Now, say when we talk about things wey fit affect the kidney, if you want to talk about the tips to protect the kidney, it's just like talking against those things, like trying to do away with those things. So that is just it. So one, taking a lot of water will help you. Two, for those who get diabetes, get hypertension and all that, control them very well. Control your sugar very well. Control your hypertension very well. It will help to protect your kidney. Healthy diet, food when you dey eat, go also help to protect the kidney. So it's good to eat healthy diet, vegetables, fruits, fruit and all that. So when you eat healthy, they eat a lot of junks and all that. When it cause another problem, we go still go affect the kidney. When go give the kidney too many work to do, then you have protected the kidney as well. When you stop to take alcohol, because remember other people when they take alcohol, remember saying when you take alcohol within 2 seconds you go the piece, because you give the kidney a lot of work to do, and the kidney go they work 247. The kidney, the liver, they go they work 247. So stopping alcohol, stopping smoking, those will help your kidney very, very well. Another one, exercise. Maintaining a certain weight and not be overweight, not become obese. Because when you become obese, overweight, that's another thing when it cause problem to your kidney. So exercise is very, very important. So if you notice, exercise is one thing where they're very important for almost every aspect of life. You get hypertension, we'll say do exercise. You get diabetes, so we'll say do exercise. Your leg they pain you, we go say there's some way your leg will pain you, we'll say do exercise. You get something, you say you know they sleep well, we even tell you do exercise. Now see kidney problem now. I thought they tell you exercise. So that's to tell you that exercise is very, very important. I don't already say maybe stop to the smoke and all that. And another very good thing is regular checkup. A good way would they do regular checkup. Just as that comment said that once you don't reach 35, personally to him, that you should be going for checkup of your vital organs every time. I will not dispute the fact. I think I will agree to that, brother. It is good to go for regular checkup. A simple check of your blood pressure can help you to protect a lot of things. A simple check of your sugar can help you to protect a lot of things. A simple check of urinalysis, just urinalysis, which is also which is not so expensive. Urinalysis, more fairly kidney function test, but more you talk urinalysis, which is not expensive, because urinalysis will point out some few things we go make the doctor say, okay, go do kidney function test. So just a simple urinalysis can actually help you. So regular checkup is very, very important. So with all these little tips, then those of us where they take concussion, different concussion, they mix this from this, they mix that to that because you want to do one thing or you need to stop them because you are giving the kidney too many work. Then those of us where they rub different things for our skin, yeah, you need to stop it as well. When they rub bleaching cream, every kind of bleaching cream, you know those things when they talk about. I don't need to call the mention name. You know them. All those creams so they use. You want change from one color to another color, or you want me that your color where you get make on turn. I don't know which color you want me to turn. And to the extent say some people can't get some people can't turn rainbow because they can't get different colors. And their face will be white, their body will be black, their cheek will be red. They just turn rainbow overnight. So all those things when you they rub, when you change, when they give us rainbow color or when they change our skin color, stop them. Once you stop them, because as you they rub them, you they give the kidney, you they in one way or the other, they affect the kidney because those things are chemicals and the body will absorb them. Not to say you say na skin dey, not be only skin because the body they absorb them, the skin they absorb them. Yeah, if the skin not they absorb them, why if you say you get pain for hand, you say rub something for that hand, massage am, and you say the hot enter inside body because the skin still they absorb things. Yeah, the skin. One day we'll talk about the skin. May you know what the skin they do for you, and how the skin still they help you, and some things when you they do when they damage your skin. So those cream, stop them because it go still affect their kidney. Then if you the kind of person where they abuse medication, NSAIDs, all those painkiller medication, even steroids, stop them because you they cause problem. You go still cause problem for your kidney. Dr. Fred.
Yeah, thank you very much, Dr. Israel. May we take some questions? We dey talk about secrets to healthy kidneys. If you get any question for us, you dey YouTube, you dey Facebook, or you even dey X and you get question for us, drop them in the comment section and we'll try our best to respond to you. But I noticed that you never share the live session, and you they ask me question. I don't mark you down. No, I don't mark you down. I don't mark you down. You they ask me question, but you never share. Oh yeah, hit on the share button and then ask your questions. Let's take the first one here. The one I can see. Say, doctor, what of the person who fasts? Can you drink water when you break it? And yes, now, when you fast, it's advisable. Remember, when you fast, your stomach has been resting for a long time. You can't just break your fast with a bar or yam or bread. You have to wake up your stomach. So it's advisable that you open or you break your fast with liquid, with water first. So yes, you can drink water. But when you say plenty water, I don't know what you mean by plenty. We know the measure, you get the point, plenty. But you can break your fast with water to gradually make your stomach and intestine active again. So yes, you can use water to start and open, because you get some people when they fast. I know why you were asking us, so let's just answer you, though it's not related to this topic. When they want break fast and they take something very heavy, they get abdominal pain. And I noticed that our Muslim brothers, they fast this period. So yes, this question will actually help. Let me see if we can go to the next question on the screen. Doctor, I've heard of liver enlargement, spleen enlargement. Is there anything like kidney enlargement? And is the actual size of kidney for an adult? I didn't get that. Is there anything like kidney enlargement? Yes, there is. Okay, respond, I beg, respond. Go ahead.
The question, and what is the actual size? I think that's what he is trying to say. And what is the actual size?
Okay.
Yeah, yes, there's something called kidney enlargement. So when the kidney does the swell, it can start to the swell. Yeah, it can start to the swell, and in fact, the kidney can also be shrinking. You the small. And okay, there's a story of somebody that had kidney problem, and the kidney was so enlarged that even they don't even know say na the kidney that enlarged, one of the kidney. It was so enlarged that they even dey think say na another organ be that. Now until they go enter theater, go check. The organ wey they think na they enter theater for. They reach there, they e shock them say not be that organ, say na kidney na your enlarged like that. So they come got to remove that kidney. Up till today, the person they live with just one kidney and is living very fine. Yeah, because he's doing the right thing. So there's what the kidney can actually enlarge. Now, I want to talk about the size of kidney, the long. It can be between 10 to 14 cm. Yeah, the wideness, it can be between 3 to 5 cm. Then the thickness of the kidney is around 3 cm. Yeah, so that's the size of an adult kidney. Yeah, so if you don't the big pass that one, yes, there could be a little problem for the kidney. Dr. Fred.
Thank you for that response. There's a question here, Dr. Israel, before we continue. He says, Doctor, what about some of us that don't feel like drinking water? And when I force myself to drink water, I feel serious stomach pain, serious abdominal pain. And my stomach will be making sound as if water is moving. Dr. Israel, I beg, help us, I beg.
Okay, when we say drink water, we not say every second go to drink water. When you don't feel like drinking water, as at that point, don't take water. There's always a time when you feel like taking water. And there's nobody when they no time when not they feel like taking water. So when those times reach when you feel like taking water, take a good amount of water. Not be all those are where you can use and test mat. Some people they feel like drinking water, they'll use a test mat. No. As at that point, take a good amount of water. So when you notice, say, oh, whenever you drink water, your stomach they do puru puru puru, normal, your intestine they move. Most of the time when that one they happen, and when you never eat anything and you go drink water or you eat something, your stomach will always move, and some patients will always have stomach pain. You go squeeze them because the job like say the stomach they wake up as at that time. But if it happen to you all the time, the next question they ask, you ask yourself is, what kind of water are you taking? Is it very cold water? If it's very cold water and you're having that kind of issue, you know that you should be taking normal water. If it's normal water, why not try cold water and see whether you get that kind of issue? And another thing, why you don't need to rush at once, you want drink at once. No. Sometimes you need to take and gradually. You take a little, keep it, take it a little. With that, you they give the intestine little by little. You can't make the intestine master and pain, you know, go feel pain. Before you know, if they take a little by little like that, before you know, if you don't finish 2 sachets of pure water, you know go even know. You just the drink and you think say na beer that you they take.
I will drink. Okay, thank you for that. Yes, if you are just coming, you're welcome. This is Ask the Doctors program. We've been on the program for 6 years now, every Sunday on Facebook and YouTube. Today, we are also streaming on X, and I can see a lot of people watching us right now. We're talking about the secrets to healthy kidneys. The major reason for this particular topic is to raise awareness, to help us, me and you, avoid kidney disease to the best of our abilities. For those of us living in developing nation, for those of us living in resource poor nation, to be wise to prevent kidney disease. Okay, we have a question here. Doctor, can dialysis reverse kidney failure? The answer is yes and no. there are different stages of kidney failure. The early stage, stage 1, stage 2, stage 3, stage 4, and then there is the end stage. At the very early stage, at the stage 1, when the kidneys are going bad, the nephrologist, listen, no, not you, your nephrologist can decide, let's take away the stress on your kidney, let's dialyze to give the kidney time, you understand, to repair itself and heal at the early stage, stage 1, stage 2. But and remember now, kidney failure is a progressive disease. It's a progressive disease. But at that early stage, yes, your nephrologist can guide you and help you reverse, especially if the damage is not permanent. But when you start getting to stage 3, or what we call stage 3B, and then stage 4, what your doctor will be doing for you is no longer to reverse, but to try and delay the progression of the kidney failure. And when you enter end stage renal failure, end stage, when you enter that end stage, it means say this person will only benefit from dialysis or kidney transplants. Now, if you have seen anybody with end stage renal failure going for dialysis or looking for kidney, it's not a sweet experience. It can drain the family financially. It will drain the family emotionally. It will drain the family psychologically, physically. This is not something we should joke with. And that is why every one of us, as one Dr. Israel said, is important that we also need to go for a checkup. Okay. So let me allow Dr. Israel respond. Please share this video. Share this video. One more, and then we'll go back to our discussion. What can we do? I guess this person is just coming. What can we do to prevent kidney disease in those that has kidney disease?
So somebody when they already get disease, you cannot prevent it again. The only thing you do is to help that person so that make it not worse past where it is. That's just the thing. It's just person, be like say person get malaria, they say, you want to prevent malaria when the person gets. You are not preventing it, you just treat the person, make it well. So it's the same thing with this person. So if the person already get kidney disease, you don't prevent it, you just treat it. Yeah, mostly as Dr. Fred thought, if you did the early stage, yes, it can be treated and you reverse it. And then when you don't reverse onto normal, I beg you can't start to do the right thing so that make you not spoil again. Because if you spoil again, my brother, if he not spoil for the early stage again, if he be saying at the late stage, now you can't know say the kidney does spoil. Yes, and we well, we don't work for hospital. We've been in units, different units. One of the units when I know they like today, maybe nephrology unit, kidney unit. Why? Because of what we this waiting we they see for them. And I made Dr. Fred they tell you say dialysis not be beans and all that. But waiting we they see for there in not they interesting. So it is better that you don't even have it than having it. So when you even don't get and you see something at the early stage, please follow it up on time so that make it not go the late stage, because you not go they fun. You not go they fun. So what you need to do if you don't already get talk to your doctor, your nephrologist. He will guide you through, he will tell you what to do, how to take your medication and all that. And then he go treat you. When they don't treat you, they come find and say, oh, your kidney don't they normal. They go tell you, they will make sure say you they come for checkup regularly. Please don't miss your checkup. So continue to they go for checkup, continue to they do tests. Why do they do these things? Because they know say person say it don't wear today, but the next time when they go see and the chronic one, and he go come with. So it's good you continue for your checkup. Then as you they continue your checkup, those things where your doctor say you not do them. Then start to the exercise, eat healthy, take water, stop drinking if you they drink, stop smoking if you they smoke. If you are a hypertensive patient and you know they take your medication before, take them very well, because they will give you the ones when go help your BP and when not go get problem with your kidney. Then if you get any other disease, even diabetics, take your medication very well. So with these ones, then you are also protecting the kidney. And you are protecting the kidney. Dr. Fred.
Thank you very much. I like the fact that a lot of people they ask us questions, but waiting they pain me be say, and you where they watch this live session right now, you know they share, and I don't really understand why you know they share. If they ask us question, we they answer you. Abi, answer now. We they answer you, but you know they share. So why? Why are you not sharing? Are you selfish? Are you stingy? You know what make your people hear the same thing, Abi? Okay, no problem. Let's see. Let's see. Can water help to flush swelling legs while on medication? No, water does not flush swelling legs while on medication. Water will not flush anything like that. Please, doctor, does that mean that kidney disease cannot leave the body? And is it only this stage it will go? Okay, Esther, there are different types of kidney disease: the acute kidney disease, the chronic kidney disease. There are some kidney conditions you can have, and you're fine, you're lucky, you are okay. But the ones that we don't want, the one where all of us they shout about, now those ones we go carry the problem enter chronic. That is, the kidney disease go come sit down inside the person body, chronic, long term. But it gets some kidney problem where somebody forget. When you manage them with your doctor, acute, you are lucky, you are fine, it go come out. But when the problem come day, you know handle them well, you know go hospital, you sit down for internet, you dey go buy medicine by yourself, you think say you know anything about your body. By the time the problem sit down inside your body for a long time, those problems fit can destroy the kidneys, come make am chronic. Now that one go come stay for the person body, go come they stay for there, they stay for there. So what we are trying to say is let us avoid anything that will affect the kidney negatively and push that kidney into chronic kidney disease. Um, Somebody says kidney failure and liver failure, which one is life-threatening? Or can kidney failure lead to liver failure? And the both of them, they are both life-threatening. We don't want anyone at all. We don't have a scale to measure and kidney failure was past this one was past this one. You should not have anyone. Liver failure bad, kidney failure bad. Kidney failure can affect the liver through a long process. Liver failure can also affect the kidney through a long process because they are all connected together. So there is no way to measure, say this one was past this one. But trust me, you don't want any one of them in your system. Liver is extremely important. The kidneys are extremely important. Dr. Israel, you want to add anything on top of this?
No, I don't think so.
Okay, it's almost time to round up the program, and we talk about the secrets to healthy kidneys. Now, one very important thing where I want me you take away from this program: if you never screen your kidneys at all, if you never do any kidney tests, I beg you, carry your body, go see your doctor. Follow your doctor talk. Say, you don't tell, since when my mama born me, I never do any screening for my kidneys. I beg, I want to screen my kidneys. I hear that the kidneys can be going bad and you no go even know. It is extremely important so that if problem day, we go fit pick am early. They hear me so? So make sure you start making plans to go and screen your kidney, whether you there for Nigeria or you are outside Nigeria. It's very important you make plans to screen your kidneys. Dr. Israel, may we try to the roundup, and we are almost out of time.
Okay. So I think we don't really talk so many things on how you need to protect your kidney. Now, when there are so many different diseases of the kidney, and there are so many different, we have pyelonephritis, acute kidney failure. Most of the time when we talk about disease of the kidney, now mainly acute kidney failure and chronic kidney failure. That most of the that we really the hammer. because every other one, the others, and majority of all those ones can be treated and you get cured. And then the acute kidney failure can also be treated, because sometimes it can just be some problem now you cause that one. So when you take care of the problem, that one will just stop. But once you don't enter that chronic, now there the wahala dey, and now there the wahala dey. So now make way, it is prevention. Now they say they better, they cheaper and better than cure. So it is better we prevent our kidney from coming down with problem, except those things we no go fit prevent. There are some things we cannot do. So when it comes to saying that one can cause the problem, we will not say, oh, not be our fault, not be our lifestyle. Now because this particular thing, I cannot do it. Like the autoimmune problem, the genetic and all that, when it not dey your hand. Even that genetic, if you take care of your lifestyle, if you not even happen. So it's not like a compulsory thing that because it dey my gene, it dey my family, say I must get it. It's not a compulsory thing. So it's good for us to know. So it also dey very good for us to know. Say once you dey notice, there are some symptoms when you fit just dey notice, and abeg, once you dey notice, and e good make you go hospital. You know, say we dey talk this thing, say go hospital. So e not mean say these symptoms, it must be say na only your kidney na your spoil. So because some of these symptoms fit be say na other organs for your body na still spoil. But once you dey see them, e good make you go hospital. One na swelling, leg swelling, even your face come dey swell. And most of the time, your face, your eyeball, all of them dey swell. You come dey get leg swelling. So that kind of one, you need to go hospital. The way you take the urine, it can't change. And sometimes it can't be saying that in the night you go peace. Or sometimes you never dey peace. You drink water, you know the peace. You need to go hospital. You will notice that you dey weak, or you dey tired easily. Or you can't notice say your taste bud, you dey taste something, you be like saying na mental, na dey your mouth. That's like metallic taste. Or you dey talk, you dey notice say you get some kind odor when your breath come be like. This one na some signs say maybe na your kidney na get problem. You need to go hospital. Sometimes you gonna get shortness of breath, because maybe water don full all your body. Remember, say we say sometimes your kidney fit affect other organ, and one of the organ, the heart. We don talk liver before. So the heart, if it still affect the heart, so if you gonna get shortness of breath, so you need to still go hospital. Or you dey vomit, and you dey feel like vomiting, you dey vomit, you lost appetite, and so many other things. Please go hospital. Then if you can't get any other disease, hypertension, diabetes, and any other chronic disease, it is also very important that you dey do routine checkup for your kidney. And they do routine checkup for your kidney, because with those ones, you will just dey protect your kidney. It is better you just you just notice those signs and you quick manage am. Now you can't wait, make you can't dey use dialysis. Dialysis is not cheap. Mostly for this part of the world, where we say we dey pay out of pocket for everything wey we dey do. Dialysis is not cheap. Even some of people wey even dey health insurance scheme, if you don read dialysis, e still get where the insurance scheme dey do reach. They'll do reach one place, they'll tell you say abeg, from now on, now you can know carry your cross for this part of the world where we dey. So we know. So it's not easy. So when you don't read that dialysis time, you know the sweet. Yes, dialysis can actually reverse some cases. In some cases, dialysis can reverse it, but in some cases, dialysis is just to keep you until the right management come. The main management, the main treatment for chronic kidney failure, na kidney transplant, na to give you another kidney, and to give you another kidney, so that other new kidney go come dey work for you. But if you don't get another kidney, e no mean say make you come go dey do, I don't get kidney, go. No, you need to protect that kidney with everything when you get, and you need to protect that kidney. So it is very important and very good to know say our kidney is a wonderful organ in the body. It helps us to remove waste. It helps us to regulate our blood pressure, our temperature. It helps us to regulate our water, the water in the body. It helps us in production of red blood cells. It also helps us in our bone health. So as we don't know all these ones, it means say it is also very good make we protect that organ when they do all these wonderful things for us. And to protect them, the very first thing to do now to drink water. Another one now to eat healthy, do exercise. It is very, very important. Do exercise. All those medication when you take when they're not prescribed for you, stop them. And when they take too many medications, stop them. Now, if not even the one when they prescribe for you, you can't notice anything, please go meet your doctor. Meet your doctor because there may be an alternative for those medication. For those medication. So these are so many of the things when you need to do, and it's very important. It's very important that will protect the kidney. If the kidney not very important, we not go get a week for the kidney. We not go get. And because it is very, very important, that is why we have a 1 full week for the kidney. Dr. Fred.
Thank you so much, Dr. Israel, and thank you for watching. In kidney transplant, does genotype matter? Everything matters. Everything matters. You don't just wake up and say you want to do kidney transplant. Everything matters. I'm using the word everything because it's a long process. It's even deep. Everything matters. Your doctors will look into that to ensure that and the person where they collect the kidney, the body no reject them. So everything matters. I'm using that word because we are on a live session like this. So leave it at that. And if you know anybody will get kidney disease, encourage them, may go hospital, support them. It's not a sweet experience. And Dr. Israel has given us a breakdown of the things we can do to help our kidneys. Now, what you also do for your family members, share this video. Nobody say tomorrow you'll come they shout, doctor, please give me your number. I want to call you. No, we don't do that here. All we do here is come online like this. We teach, we educate, we have fun, we answer your questions. Like how many times can we check liver kidney test in a year? Like once in a year. It's not something you should be checking. But if you have a condition or you get problem for your body, your doctor can advise you how many times to they check. But if everything is fine, annually, some people now once in a year that they check. And then every other advice we give you here, I want you to follow that advice. Please don't forget, we are live on Facebook, we are live on YouTube, we are also live on X. This program is every Sunday by 8 p.m. to 9 p.m. And we don't do and become for 6 years. We don't joke with our time. We don't joke with your time. It's almost time to round up on the program tonight. I want to believe that you gain 1 or 2 knowledge. Please, don't joke with water. Leave smoking, leave alcohol. Don't abuse medications. And most importantly, speak with your doctor. Google is not doctor. Google no be doctor. Do you hear me so? Google no be doctor. I want to use Chat GPT to help myself. People don't buy because of Chat GPT. They mismanage themselves. And then when complication comes starts, they'll come, they run, they find who to help them. So please discuss with your doctor. No fear. Now your doctor, no fear. Follow and rub mind. Have this one and this one and this one be. I not talk say me online, I'll be your doctor. I'm not your doctor. No. I'm just here to teach you. But the most important person for you is your own doctor at the hospital. No use and play. It clear? I be no clear. Answer me. And once again, I want to appreciate Betty. Betty on YouTube. Betty Pretty sent 1,000 naira super sticker on YouTube. So on the live session, you can appreciate people and send them cash actually. So Betty sent 1,000 naira tonight, and I want to say thank you to you. God bless you. Another woman who will carry your husband. And if you never marry, you go marry. If you never born, you go born. Thank you so much, and we appreciate you. Eclair, thank you. I'll see you next week Sunday on this same platform. no forget, like I always say, good life now waiting. Good life. Good life. I say so. Bye.